Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Rani Nassar, Public Information Officer for the Harford County Health Department, and your host for today's Public Health Matters, the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. Today's topic for Public Health Matters is adolescent mental health, which is a growing problem with children and teens across America. We will be talking about this issue in order to raise awareness of the stigma around mental health and identify resources for those in need. Joining us today is Deputy Health Officer and Director of Behavioral Health for the Harford County Health Department, Andrea Pappas, and Christina Alton, Mental Health Specialist at the Harford County Public Schools. Welcome to our show, and thank you so much for being with us today.
Thank you.
So we're just going to get started. Can you both just tell me a little bit about yourself and what your connection is to adolescent and youth mental health?
Sure. Thank you again for having me here today. My title is Mental Health Specialist, but I'm a social worker. I've been one for about 28 years. Which is a really long time. And most of that time I've worked in school settings, and so of course working with children and adolescents, and that would be my connection to mental health.
Great. Thank you again for having us here. You know, I think this is a really important topic that we can bring to light and discuss today. So as you mentioned, I work at the health department. I am actually a licensed clinical professional counselor, and I've been one for over 10 years now. But so at the health department, not only do I work with direct clinical services with clients, but I also oversee all of the mental health programs and behavioral health programs that come out of the health department.
Great, thank you again. So we can definitely agree this is such an important topic to bring to light today. What is some of the stigma that surrounds youth and adolescent mental health today?
I think some of the stigma that surrounds it is just youth and adolescents feeling that they are alone in this, that they're the only ones struggling with this, that they don't realize that it's okay to not be okay, and they kind of feel that, oh, no one else is experiencing this, I'm alone in this, no one else feels what I feel, when in reality a lot of their peers actually feel the exact same way they may be feeling.
And I also think that when we think about mental health, we go directly to disorder or illness, and really we all have mental health. Just like we all have physical health, and both are on a continuum. Sometimes you might be sick, not feeling well, have a cold, a headache, whatever. But mental health is very similar. If you have a loss, you're very sad. That doesn't mean that you're diagnosed with depression, but certainly your mental health is suffering because of it. When we think about our students, you know, before a big test, they might get really, really nervous. That doesn't mean that they have an anxiety disorder. Certainly their mental health is suffering because of that. And so I think the more that we normalize the discussion around mental health and liken it to our physical health, I think the more likely people are to talk about it, to seek help, and get assistance that they need.
Thank you. According to the National Association on Mental Illness, 45.5% of Marylanders ages 12 to 17 who have depression have not received any care in the last year. What are some barriers for some adolescents who what they might face when they need to get help, and why is it might not be easy getting help for such an outside wound that people might say?
You know, one of the things I believe, I think sometimes as adults, we tend not to take seriously some of the mental health concerns that children bring to us. We downplay it just a little bit, which leads to them not getting the support that they need and maybe shutting down and not talking about it because somebody's told them, oh, you know, you don't have anything to be sad about, you have all these wonderful things, or what do you have to be anxious about? And I think as adults, we should be encouraging them and trying to get them support if they need it. The public health or getting mental health services can be difficult. It's a difficult system to navigate. Finding the right therapist for you, it's not one size fits all. Sometimes the cost is prohibitive when we're talking about co-pays, if you have multiple people in a family who might require therapy. So those are just a few of the things that I can think of that might be barriers to people receiving treatment.
And to your point, I think a lot of times parents may overlook certain symptoms that may be more physical, present more of a physical nature, stomach aches, things like that. They want to rule out medical conditions before we take a closer look at mental or emotional conditions, but that can also take time, to evaluate and rule out medical conditions and then kind of delay seeking that treatment for mental health disorders and conditions. And I think another barrier too is the provider network, the specialty providers for youth and adolescents, as well as more specialties amongst, even that provider network, that it's a limited network of them, so then their wait lists, and those can all be barriers at times of when someone needs that help right now. It may be delayed, unfortunately.
Which adolescent groups, when we're talking about adolescent groups, the LGBTQ community, some certain racial ethnic communities too as well, how are they more likely to be affected by poor mental health than others, and what could be some of those reasons?
I think for those groups, they may feel more isolated, more marginalized than most, because they feel they already are struggling sometimes to accept their own identity. So then that makes them more reluctant to go speak to other people that they feel won't understand them either. They may be a different gender, different sexuality, different race. They may have difficulty then relating to providers that they may go to.
I agree with Andrea. It's very isolating to feel like you're in one of those groups that are oftentimes given messages that they're less than, that maybe they're choosing this and that's not necessarily the case, or that they feel they don't fit in. And adolescence is hard enough. And so if you're also identifying, if you're questioning your sexuality, something like that, that's even more isolating. And it leads them to maybe not talk about supportive services that they need. And if they're not feeling supported, maybe they're more likely to internalize rather than externalize.
And we've discussed too, culturally, sometimes there could be stigma around certain cultures receiving certain mental health to care, any type of just even talking about it too sometimes. How about influences for poor mental health? Do you think it could be possibly more genetic, environmental? What are just some influences that can affect any type of adolescent or youth mental health?
It's both. There can be a genetic component to mental health disorders, but also environmentally. If you think about how our children are growing up today and all the influences, I'm so grateful that there wasn't social media the way, when I was growing up versus today. So I think it's a combination of both, and when you're evaluating someone, you're going to take a good family history, but also thinking about the environmental things that are present for them if they've experienced trauma in their childhood, that has an impact. So my answer is both. So maybe that's not quite the answer you were looking for, but it is both.
No, I completely agree. And you look at families that there may be co-occurring conditions, there may be substance use concerns. You have to then look at if a parent is struggling with substance use concerns, they may also have co-occurring mental illness. And then that can impact not only the quality of life that they provide their families and their children, but then there's also that genetic piece that they may be inheriting. They may be predisposed to those conditions as well. So that kind of nature versus nurture, it's both in those situations.
That makes total sense too. Let's go into a little bit about some of the signs of depression, anxiety disorder, any other type of mental illness. What should family and friends look out for if there is an adolescent or youth that are experiencing a mental health situation?
I guess, at its most basic, looking at their normal behaviors, that child's normal behaviors, and noticing deviations in those behaviors. If a child becomes more reclusive, more isolative, like what is going on? Why are they more closed off? Why aren't they taking, again, interest or pleasure in things that once gave them interest or pleasure? But then also, I know we mentioned before medical, also taking note of, if their eating habits change, sleeping habits change, socializations change, kind of looking at their norms and how they have changed, because most parents and most supports know and recognize that individual child's behavior, so they're the first ones that can see if something seems different or something's gone amiss.
Adolescence is full of changes. It's such a difficult time because oftentimes what is typical adolescent development, it does kind of look like a mental health issue. So it's really important, like Andrea said, is not typical for the person that you're thinking of. You may have a child that's quiet, but isolated and not communicating with anyone. Anything, like she said, that deviates from what is typical for that child that you're thinking of is really important and extends for a fair amount of time and begins to impact what they are able to accomplish on a day-to-day basis. Maybe they're starting to miss school, or they're not hanging out with friends, or they quit a team that they really enjoyed being a part of for seemingly no reason, and don't replace it with something else, because it's typical for teens to have a lot of interests and change those interests, but when they don't replace it and become isolated, don't want to be with family or friends, because that's also, so they sometimes don't want to be with us as family, but they do want to be with their friends. They don't want to be around anybody. So it's really about what's typical for the individual that you're thinking of.
And what would be the best way to talk to someone about maybe getting help if you do see maybe that, like you said, deviation of what their normal day-to-day looks like?
I think it's important to, first of all, be very non-judgmental and keep an open mind and have them, you know, I used to talk to my daughter all the time in the car because we were together and there was really no way for her to get out. And really, your observations, I noticed that. Can you tell me a little bit more about that? Maybe some questions, not open and not closed-ended questions like, how are you feeling? Well, I'm okay, because that's what kids say, I'm okay. What's going on? Nothing. But, you know, I noticed this, and I'm just wondering, and maybe go on from there. Can you tell me a little bit about that? I think all of those are really important things. I think it's most important as adults that we kind of put something out there and be quiet for a little bit and just listen, and to be able to say to your child, I'm here. I'm just letting you know the things that I've seen. When you're ready to talk, I'm ready to listen. I think that's really important, and to definitely not be judgmental.
Yeah, no, I agree completely. And also, along with not being judgmental, not being accusatory, or not, you know, if they are struggling, to come in and, well, you know, why is your room still a mess? Or why are you in bed all day? You know, try and get to more of what's going on. Like, hey, I've noticed you didn't leave your room all day. Like, what's going on? Like, you okay? Like, and if you're not ready to talk about it, I'm here when you are. So again, trying to foster an environment that is supportive, is safe, is one that can kind of foster that communication if and when that child is ready to talk about it.
Yeah, continue with the compassion for sure. How are mental health situations diagnosed? What kind of goes through, what's the process for that?
So typically what happens is when a child presents, they, not only is there a full assessment done of questionnaire of what brought you in, tell me about your home life, your school life, your typical behaviors, kind of more maybe newer behaviors, how long have they been going on, but also seeking input from trusted other, you know, family members in the child's life. So parent or guardians, coaches, teachers, school systems, other people to kind of give other information, to kind of collaborate to figure out what is going on, how long has this been going on, what are these patterns normal, and also to look at that family history, because like we said before, that does play a part into things.
And they're going to be diagnosed by a qualified mental health professional. We have a book called the DSM that has all the diagnoses that, based on symptoms, could be diagnosed as a mental health disorder. And you know, the difficulty is sometimes that it's all based on self-report, really, a lot of it. And and as you said, there are things that we can't see that folks tell us about. And so it's really based on observation and self-report, which can make it very difficult. But it's okay, it can be fluid as well, that a diagnosis might change based on more information that we uncover as we create a relationship with someone, a therapeutic relationship. So it can change.
And so we've seen an increase in depressive disorder with youth and adolescent throughout the past few years. What would you say could be some of the factors that could play into this most recently?
Again, I'm going to go back to the digital natives that our kids are. This generation of children has never not known a world without computers, without cell phones, which are basically a computer that you hold in your pocket. And social media is so difficult. I mean, everybody puts the best things. They use filters that make everybody beautiful. And kids see that and they compare themselves, and they're already doing that as adolescents. And I'm not as pretty as everybody, I'm not as popular as everybody, and look, social media is proving it to me. I didn't get invited to something, or this person's life is so great, and mine, I don't know, mine's not so great. I read an article recently, and there was a study where people were asked to rate themselves on a scale of 1 to 10 before they went on social media, 10 being the best mood ever and 1 being the least, and then they were asked to rate themselves after, and by and large, most people reported feeling worse after they left social media. And when you think about kids and how they internalize all of those things, and if they're already not feeling so great about themselves or just wondering, am I normal? Is this, you know, and then they see from other people on social media. So I think that has a huge impact, and certainly the pandemic and the isolated nature of that didn't help things. But I also think that people are talking about it more. And so I think it's helping kids to be diagnosed and get support because we do talk about it.
And I think now, because of the pandemic, you know, I think a lot of resources were maybe not as available, especially when things were shut down or more only available virtually. You know, that kind of isolative nature of what we all went through kind of changed the landscape, changed the treatment landscape, but also kind of having these youth and adolescent connected to these resources and to this landscape also changed. So I think beyond the kind of influx of social media, seeing what the pandemic did not only to youth and adolescents but to their families. They saw, you know, their parents, you know, and the fear that maybe that caused them, and you know, family members that were out of work or lost homes, and you know, there was a lot that was going on that probably didn't make sense to a lot of the youth and adolescents. That again, seeing your family members also struggling, it, you know, was kind of a perfect storm.
So speaking of the pandemic, how else do you think that it impacted youth mental health? I know, Andrew, you touched on it a little bit. Is there anything else that we might have missed with COVID that could have affected youth mental health?
I think when, you know, kind of the world did shut down, a lot of providers were offline. You know, even if it was temporarily, they were offline. And a lot of it for a good time being was all virtual. Not every family has access to internet, has access to smart devices. So that kind of it became a barrier that we never had to think of before, because you would just go into someone's office. Well, offices were closed, you know, internet may not be available to some families, or it may be spotty internet. And some providers, you know, then you have to get into the whole world of insurance that, you know, some insurance, I think all were covering it during the pandemic, but then some stopped coverage, and then, you know, trying to get back in when maybe people didn't feel comfortable going into the office. And it changed the treatment world, and then unfortunately kind of made some barriers of access to that care.
And I think maybe there's a positive byproduct. Perhaps families spending so much time together, they were able to really see, you know, matters or things that may be impacting their children, and decided to get help because maybe it wasn't just happening in school. I'm watching it, I'm seeing it happen myself. I'm really concerned for my child. So perhaps that's a positive thing. And so maybe more people are getting support, and it's why there are wait lists, because people had that time to spend with each other and realize that, you know, maybe this is more than just being a little sad, or more than just typical adolescence. So if there were some positive things that came out of it, that could be one of them.
So lately in the news, we've seen all over the Russian-Ukrainian war, and there have been so many other news events that have happened that are all over media the past few months. How do you think this, just the war and even probably the other events too, impacted children's mental health lately?
And you know, as we were talking before about social media, I think, you know, anything that is on social media, the kids are sponges, they're going to pick up on it. So seeing things of of that nature, of, you know, that magnitude, that's scary to them, that they're going to have questions that we may not even know the answers to. So I think it did increase some anxieties or fears, you know, related to, you know, all of the things that are in the news that kids are exposed to through social media, as well as things that, you know, adults might be talking about.
How can we as the health department work to break down barriers and the stigma around adolescent mental health?
I think having shows like this are a great way to start. Having those conversations and making it okay, like Andrea said before, it's okay not to be okay, and mean that. But I think as we talk about it, and I you know, working with kids, this is a generation also of kids who are really in tune to mental health. It's really, really important to them. And they want to talk about mental health. They want people to support them in their mental health, and they also help each other a lot. And they're aware of the supports that are out there, and sometimes it just takes them to convince the adults around them that, I am struggling with my mental health and I want to get help for it. So I'm really hopeful, and I think that in the last few years, mental health has just become something that everyone seems to be talking about more and more comfortably.
Yes, exactly. And I think just by continuing to foster an environment that makes people aware of the signs, of the symptoms, to try and engage more preventatively, as well as try and develop more of that kind of whole holistic approach to treating youth and adolescents that may be struggling with mental illness, but also by reinforcing to them that it's okay to be struggling, and then to point them in the right direction to get the help that they may need.
And how about with Harford County Public Schools? How does HCPS assist students who are in need of mental health assistance?
So all of our schools have a school counselor, we have school psychologists, some of our schools have school social workers, so those are people that are available every day to our students. But those individuals also work with families to secure outside resources, make recommendations. We also, every one of our schools has an agreement with a outpatient mental health clinic, in that we refer students to that outpatient clinic, but they provide the services in our school buildings. Okay, wow. And that's certainly more than what our school-based people provide, our social workers and our counselors and our school psychologists. And that's great for a lot of families who might have barriers to getting that treatment somewhere else. Maybe transportation is an issue. Maybe they're just really, we talked about it's hard to access services just in general. It's meant to break down barriers for our families and just be one more thing that we do to support our students and their families.
I also want to talk a little bit quickly about treatments that are currently available for mental health issues such as depression, anxiety. What are some of the best treatments that they can access?
So I think there's, therapy, different types of modalities of talk therapy, there's cognitive behavioral, there's whatever approach is most beneficial for that particular client. There's also medication options that, again, working with a trusted provider that can kind of help navigate that, because that's also scary too. Medication doesn't necessarily isn't a one-size-fits-all for everyone, and trying to see kind of what medication options are best for that child. Again, like we mentioned, talk therapy, but also group therapy as well, so that they can be in groups of their peers in a constructive clinical setting to kind of work and navigate some of their issues.
Agreed with everything that you said.
And what are some things that parents can do to help us promote good mental health with children, especially starting at an early age?
I think validating and acknowledging what our children are going through, but also, the basics, getting a good night's sleep, limiting their time on screens, healthy eating habits, ways to manage their stress, not completely shielding our children from stress, because that's not helpful either. They do have to learn coping skills, but teaching them those coping skills. Having a predictable schedule, which can be very hard because families are super busy. But I think all of those things combined, the good health and exercise and sleep, and again, acknowledging and validating that they struggle, and keeping open lines of communication with your children is also extremely important.
Absolutely. And, again, like you mentioned, just fostering that environment that they can talk about these issues when and if they're ready to. And, by trying to give them as much support and support networks and systems as you can, and so that they know that there is a village surrounding them that,
Is there anything else you both would like to add for today? Anything else that we could say to comfort people who are experiencing a mental health issue?
I think that it's okay to feel that way. And it's also okay to ask for help. I think we're not very good at asking for help. And everybody's busy, but we need to make time to take care of our mental health. And sometimes that means unplugging. And especially as adults, we can't help children if we're not taking care of ourselves. And being open to and really listening to what our kids are telling us and how they might be struggling. And that it's okay not to be okay.
Yeah, absolutely. And like you mentioned, taking care of ourselves. They say, you got to put the mask on first in the airplane before you can put it on someone else. Taking care of ourselves before we can take care of the people around us, especially our children who may not feel that they have a voice or a voice that can be heard. Fostering environments that they feel heard, but also making sure that we're able to receive what they have to say as well.
Great. Thank you so much, ladies. I appreciate it. Well, that's all that we have time for today. I'd like to thank my guests on today's show, Andrea Pappas and Christina Alton. If you would like more information on adolescent mental health and behavioral health programs, please refer to the resources page after the show. And join us next time for another important issue that matters the most to the citizens of Harford County. Thanks for watching.